Intervening in a hospital setting is a unique opportunity to reach young people with support when they need it most. Brief interventions can help young people develop problem-solving skills and connect them to essential services to mitigate harm and protect them in the future.
As a physician, my early days of standing in the trauma bay, seeing kids who we sent out and then we failed and come back and see them in the trauma bay, sometimes bleeding to death, and knowing that we hadn't done enough, and that's very motivating. Injuries are the leading cause of death for 60% of teens and adolescents and children throughout that early age of their life, and we're working to decrease those numbers.
The SafERteens study is an evidence-based, one-on-one, 30-minute brief intervention that we do with youth that come into the emergency department for anything. We approach people, get informed consent, then do a 30-minute brief one-on-one session with them, talk about their goals, what they want out of life, their experiences with fighting, and then go through different role plays with them to talk about different skills that they could use to either avoid fighting in the future and think about those things.
The notion behind this is this public health model where instead of waiting for someone to enter a treatment center or a criminal justice setting, why can't we take interventions and bring them out to kids in a prevention-focused way, or from young people who are experiencing some risk behaviors, and do interventions to really change their trajectory in life.
With this intervention, it's a lot of times the first time that anyone's asked our youth what they want out of life and what their goals are, how they can achieve those goals. So once we start talking to our youth, sometimes it's like a faucet turning on and they get really excited and they really want to process that with someone who really cares and understands them and has confidence in them that they can achieve their goals.
When we initially started, people said, kids aren't going to want to talk to you about violence. Well, they're there for their belly pain or their foot. And we found that to be completely not true. Nobody else is talking to these kids about the violence that they're experiencing in their life. They want to talk about it, and when given the opening in a safe space by trusted professionals who are non-judgmental and are not blaming them, they open up and they're very, very much want to talk to us, and sometimes don't want to stop talking to us and would like to come back and talk to us again about this. They then see the emergency department as a place that cares about them as a whole person and understands all of what's going on in their life, not just about what they're there for that day.
It's really great that we have an evidence-based practice that can really be used throughout the country now to prevent youth violence.
In addition to reducing peer aggression in our study over 1 year, we also found that the intervention reduced involvement with peer victimization, as well as dating victimization. We also find that it reduced consequences related to violence, which is important, and these include things like injury, missing school, and having interpersonal conflicts with friends and family. And finally, the intervention reduces alcohol-related consequences because it focuses on risk factors for violence, which include mood as well as alcohol and other substance use behaviors. We're really committed to making this intervention part of the sort of real-world clinical care, and I feel like that's really exciting.
SafERteens is one example of an evidence-based program in CDC's Technical Package to Prevent Youth Violence. Use CDC's technical packages to prevent violence in your community.